for men over 60. Please note, my name is Dr. Eduardo Vasconcelos, and I am a urologist with more than 30 years of experience. Over the years, I have encountered many fears, worries, and misconceptions among men over 60 regarding male sexual health. That is why I decided to make this video, to speak frankly and openly, without embellishment, about everything you need to know. No taboo topics, no judgment, only facts. This is a subject few discuss. It concerns many men throughout their lives. To have or not to have a foreskin. Does it really affect intimate health, pleasure, and sexual function? The foreskin is a thin, elastic fold of skin that naturally covers the glands, the sensitive part at the end of the penis. According to a World Health Organization report, an estimated 37% of men worldwide are circumcised, while approximately 63% retain the foreskin. For centuries, this question was hushed up because of tradition, religion, and shame. Today, thanks to scientific progress and access to reliable information, we can finally state unequivocally, yes, there is indeed a difference between circumcised and uncircumcised men, and it can significantly influence hygiene, sensitivity, and even health. In this video, we will examine what actually happens to the body with circumcision, what the real consequences of this intervention are, both positive and negative, and in which situations it can be a truly necessary medical procedure. We will talk about this objectively, without speculation, bias, or exaggeration. Only facts, so that you can truly understand your body and better care for your intimate health, especially after 60. And before we begin, write in the comments how old you are and where you are from. This will help me better understand who is watching, so I can select topics ever more precisely. Let's go. What is the foreskin for? Some consider the foreskin an insignificant detail, yet it is a natural element of the male body with specific functions from birth. Medically, it is called the prepuce, a double layer of skin that surrounds the glands. In infancy, this layer does not fully retract yet, but over time it gradually separates and begins actively protecting the glands while also performing other important functions. The foreskin serves three key functions. First, protection. It acts as a natural barrier, shielding the glands from constant friction against clothing and from exposure to microbes, dirt, and irritants. Second, moisturization. On its inner surface are glands that secrete fluid to maintain moisture and protect the glands. This natural moisture supports local microflora and reduces friction during intimacy. Anatomical studies reveal that the tip of the penis is rich in thousands of fine nerve endings, extremely sensitive to the lightest touch. This means that for many men, it plays a direct role in pleasure and sexual arousal. These three functions, protection, hydration, and sensation, explain why the presence or absence of the foreskin can truly influence a man's intimate health and sexual sensations. Circumcision, or removal of the foreskin, is a surgical procedure with a long history across cultures over thousands of years. Today, the issue extends beyond religious and aesthetic considerations to become a subject of serious scientific research and discussion in public health, where decisions are based on medical data. Numerous studies have shown that in some cases circumcision can bring real benefits for men's health. The main ones are, first, reduced risk of urinary tract infections. In circumcised males, especially in the first years of life, the risk of UTI is significantly lower. According to the U.S. Centers for Disease Control and Prevention, CDC, this protection is particularly relevant for children and older adults with increased susceptibility. Second, lower risk of certain sexually transmitted infections. Studies conducted in African countries and published in the journal The Ellen showed up to a 60% reduction in HIV risk among circumcised heterosexual men. There is also a documented decrease in human papillomavirus, HPV, which causes genital warts and penile cancer, as well as genital herpes. Third, reduced risk of inflammation of the penis. Removing the foreskin simplifies daily hygiene and reduces the likelihood of smegma accumulation, which in turn lowers the risk of conditions such as balanitis, posthitis, and inflammation of the glands and foreskin. This procedure is particularly helpful for men who have difficulty carrying out hygiene independently. In addition, circumcision reduces the risk of penile cancer, although this disease is uncommon. It is important to note that penile cancer is directly associated with HPV, chronic inflammation, and poor hygiene. Because circumcision reduces exposure to these factors, it is associated with a lower lifetime probability of this tumor. A fifth aspect is improved intimate hygiene in high-risk populations. In older age, maintaining intimate hygiene can become problematic for many reasons. Reduced mobility, dependence on outside help, use of diapers, or weakened muscular activity. In these situations, the presence of a foreskin can complicate cleaning and increase the risk of infections. Circumcision eliminates the need to retract and deeply clean the glands, making daily care simpler and more effective. These advantages are documented by organizations such as the WHO, the CDC, and reputable medical journals. But note, circumcision does not replace condoms and does not eliminate risks entirely. It is a risk reduction measure, not an absolute guarantee. Risks and drawbacks of removing the foreskin. No medical intervention is neutral. Even a procedure considered simple, like circumcision, carries risks, side effects, and irreversible consequences that must be carefully evaluated. Below are the main points that science and clinical practice identify as genuine drawbacks of removing the foreskin, especially if the operation is performed without clear medical necessity. First, it is a surgical procedure, and it carries risks. No matter how safe the technique, circumcision is surgery, and, as with any intervention, there are risks, albeit small, of complications. Severe postoperative pain, especially in adults, bleeding at the incision site, secondary infections, particularly if postoperative care is not strictly observed, and local inflammatory reactions during healing. In experienced hands, such complications are rare, but they exist and the patient should be informed. Second, there could be technical error in removing the skin. One of the less discussed, yet fairly common risks is an unsatisfactory aesthetic or functional result. This occurs when too much skin is removed and the penis appears shortened or tight. Too little skin is removed, requiring revision surgery, or visible scars or indentations form that interfere with erection. Sometimes, even when the operation is technically successful, patients may feel discomfort with the appearance, negatively affecting self-esteem. Another possible consequence is partial loss of penile sensitivity. The foreskin is rich in nerve endings, containing thousands of receptors sensitive to delicate touch, warmth, and pressure, especially on its inner surface. After this area is removed, sensitivity is lost. Moreover, constant exposure of the glands to clothing and air leads to keratinization, causing the skin to become rougher, drier, and less sensitive. While many men report satisfactory sexual lives after circumcision, others note a real decrease in pleasure, duration of arousal, and orgasm intensity. These changes are individual and vary from person to person, but they must be considered when making a final decision. Fourth, removing the foreskin results in the loss of three important biological functions. The foreskin protects the glands from friction and infection, maintains natural lubrication that reduces friction during intercourse, and directly participates in tactile pleasure, as its movement during sex is a key stimulation factor for many men. No other body part performs these functions. Circumcision is irreversible, and its functions are lost. A hasty decision can lead to regret. In adult men, especially when the operation is performed for aesthetic, psychological, or social reasons, the risk of regret is quite high. Some men report deciding without fully understanding the consequences, leading to a sense of loss of identity, reduced self-esteem, or diminished sexual pleasure. Therefore, it is necessary to weigh all the pros and cons before making such a decision. The decision to remove the foreskin should be balanced and informed, made with a deep understanding of all nuances and consequences on both sides. Although we have already discussed the advantages and disadvantages of circumcision in general, there are situations unrelated to aesthetic preferences, cultural traditions, or prevention in which removal of the foreskin is an urgent medical necessity. These conditions require consultation with a urologist and often cannot be treated without surgery. Consider three main situations. First, true phimosis. This is a condition characterized by the inability to fully retract the foreskin to expose the glands, even after puberty or in adulthood. In some cases, phimosis is mild and does not lead to serious problems. But when it complicates daily hygiene, causes pain with erection, leads to skin tears and scarring, or causes recurrent infections, surgery becomes the best option. Phimosis can affect sexual life, self-confidence, and even overall penile health. In such cases, removing the foreskin is not a choice but a treatment. Second, paraphimosis, an emergency. Paraphimosis occurs when the foreskin has been retracted and then cannot return to its natural position covering the glands. A tight ring forms behind the glands, impairing blood circulation in the area. This is a urological emergency. If not treated immediately, it can lead to severe swelling, acute pain, and in severe cases, tissue necrosis. Emergency treatment may be manual or surgical, but if paraphimosis recurs more than once, the medical recommendation is usually unequivocal. Perform circumcision to prevent recurrence. Third, chronic balanoposthitis. This is recurrent inflammation of the glands, balanitis, and foreskin, posthitis, which may be caused by poor hygiene, allergies, fungi, bacteria, or dermatologic disease. When episodes are rare, treatment involves ointments, local hygiene, antibiotics, or antifungals. But if they become frequent, painful, or hard to control, removing the foreskin is considered the most effective solution. Older men, diabetics, or people with weakened immunity most commonly suffer from such chronic inflammation. Other less common situations, such as HPV-induced warts under the foreskin, fibrous scarring, or recurrent infections in bedridden patients or those with neurologic disease, can also be grounds for circumcision as a therapeutic measure. In these cases, it is not about prevention or appearance. It is about resolving a specific health problem that worsens the patient's quality of life. Personal or medical decision. After reviewing the facts, a question arises. If I have no problems, should I have the operation? The answer is simple. It depends on the situation. In newborns, the decision is usually made by parents, often influenced by religion, culture, or preventive goals. In adulthood, the choice becomes more personal and should consider 3 points. If there are symptoms or recurrent inflammation, that is a medical indication. If the foreskin causes discomfort or makes hygiene difficult, surgery may improve quality of life. If the motivation is aesthetic or preventive, the choice should be informed with full understanding of pros and cons. There is no universal answer. Every body is individual, and only a urologist can give an accurate recommendation. Practical advice and conclusion. If you feel pain or discomfort, have difficulty retracting the foreskin, or have already faced recurrent inflammation, do not ignore it. The first step is to see a urologist. Only a physical examination can show what is actually happening and whether removing the foreskin is recommended. The internet can provide information, but it cannot make a diagnosis. Do not make decisions based on random opinions, forums, or external pressure. Your body deserves respect, and so does your intimate health. If this video has clarified the situation for you, share it with other men who may be silently experiencing the same doubts. Men's intimate health is not a taboo. It is care, it is awareness, it is longevity.